Morning, good evening, good afternoon, depending on where you are in the world. Hope you're having a great day. On the left-hand side is a brief of what we will be covering today. So I'll move that out of your way, but I'll put it somewhere where I can make sure I don't miss anything. There we go. What a beautiful, beautiful day we're having here in South America. Sunny, clear skies. It's been raining for 6 weeks. Record rainfall, which is great. I've never seen so much greenery in a desert type area that we live in, and I'm excited and happy to see the beautiful lush green and the flowers. We're heading to spring soon. I noticed the birds are getting excited because it'll be a big laying season for them, and life goes on, the circle of life as we call it. Today's just a general chat, no PowerPoint presentation. I'm going to talk about the good, the bad, and the ugly, the things that I see people getting wrong, the misinterpretations and misunderstandings that some people can have, with the hope to clarify that for you, you don't know what is important until you know. If you're baking a cake and you didn't know to put a critical ingredient in, it won't work out. And you always hear me repeat this again and again and again. And it frustrates me that people who delay, because delay is the reason people fail, the number one reason people fail. A lot of people fail because they get the formula wrong. A lot of people fail because they stress too much. You need to be handheld, confident, and head in a direction that has seen results. And we're going to talk about that a little bit today. Everybody's different. There's no 100% guarantee. You'd be foolish to think that from anybody. I hear these stories of these particular one-off therapies that people are doing. In fact, people are sadly dying because they're being told a therapy is good for them. And once the cancer's gotten beyond a certain size, you need to throw everything at it. Everything. You can't rely on one. You can't do one therapy and think, I'll try this. Vitamin B17, I heard such good results of that from certain people. I started with that therapy, and the reason we now have 10 therapies, very individual and targeted, but all complement one another in a certain way. So you can do certain, there are other therapies that are oxidants, and oxidant therapies you can't take antioxidants with them because they neutralize each other. I won't name them, but there's certain therapies out there that are oxidative therapies. Malaria medication is one of them. That if you're on a low budget, you can research that and look into that. Call me, I'll help you. Now, we help so many people without money, and I would say I'm spending more than 30% of my days helping people all over the world do what they can do with the limited budget they have, with low funding. And they don't pay me for that. It's complimentary. I do it because I love helping people. It's my mission in life. And it's so important, if you're going to do something, to do it correct, to get it right. It's sad to hear people that delay things and delay things. We had 4 people this year, 4 people, of which 3 I know are not going to make it. 1 I haven't heard from, who wanted to wait for a scan, wanted to wait for something, and the delay after delay after delay has meant that it may be too late for them. And the ones that have passed away, we know it's too late for them. Time is of the essence. You're days away from a critical breakthrough. What is a critical breakthrough? Let's say you have a tumor where you know you have your tumor, and let's say it's about to break through the wall. You don't know that. If it's the lung and it breaks through the wall, it can be critical, and it can lead to death. If it's in the liver, it can cause bleeding. You become anemic. A lot of people with cancer become anemic anyway, because cancer uptakes all of your goodness from your body, uses up to 10 times more iron than your normal cells do because it's multiplying so fast. Even though it's small, even though it's you know, 1 inch, 2 inch, 25 mil, 50 mil, 75 mil, even though their collective numbers are so less than all the cells in your body, they are rapidly growing. And so if they're staying the same size, you might say, you know, it's been the same size for a year, very rare. But if that's the case, it's still rapidly growing, but the die-off is the same as the new cells. If there's a net growth, then there's more cells growing than a dying off. Either way, it's taking energy from you and using your iron up. So let's go through the list just briefly. What are our highest success rates with cancer? Cancers that are high in the bodies, so the neck and above, including the esophagus and the brain. The only difference with the brain cancer is it takes a little longer, and it's a completely different formula than we use on the rest of the body. Every organ has a different formula. So you have breast cancer, and another person comes with breast cancer and breast cancer in the liver, and another person comes with breast cancer in the liver and the bone. 3 different formulas. 3 different formulas for each organ. It's very, very important that you understand this. This isn't one shoe fits everybody. It's individually made. Individually made for your type of cancer. You are special, you are unique. In addition to that, you have, in the form that we ask you to fill in to get on the program, we ask you your 5 biggest health challenges. And they are, you know, sugar, diabetes, overweight, underweight, constipated, can't sleep. They are individual problems for you that also need to be addressed with other IV therapies, be them amino acids, be them high levels of certain minerals that boost your pancreas, help your digestion, in probiotics, prebiotics in your gut. These are all underlying things that are equally or more important than the therapy that will eliminate you from cancer. Why? I like to use things that you can visualize. So you've heard me use this one many times. So let's say you have a fire in the house. The fire's in the back part of the house. It's not affecting the main area. Fred's watching television. The dog's outside, hasn't noticed the smoke. It's little. Do you want to go and sit down with Fred and watch television, or do you want to put the fire out? How urgent is that? So when you have cancer in your body, it's that level of urgency you need to consider. If you want to save your life, if you want to live, you need to treat this thing with urgency. Because somewhere between the day you were diagnosed and the day it's too late is somewhere either just past or closely in the future. And nobody knows that day. All I know is people who unnecessarily delay for reasons that they think are very, very important, but they are not important. You know, some people, I want to get a scan before I leave. Why would you do that? You want to get a scan before you start a treatment and compare that scan on the same machine to the next scan so you know how you're going. So if you wait 2 months or a month or 6 weeks or whatever to do a scan, when you arrive here, let's say we do some sort of test 2 weeks or 3 weeks into your program, it's the same size, hypothetically. You don't know how much it grew in those weeks before you came here. You need to have the scan before we start, and then as many scans as you want through the progress. Before I end, I want to just mention there's some unique special offers that we haven't offered. Usually December we offer a special price to people, yes? And you all know that if you're a follower of mine, if you're a fan of mine. But not only in this around Easter time, you'll get some Easter eggs, which are special things that you didn't hear about or know about before. There's a big Easter egg at the end that I will mention, which is regarding price. We've had meetings this week. The economies, the world economy, some people are suffering, and we spoke to our suppliers this week, and we've managed to secure a special offer that we can only offer to a limited number of people. The reason being, if you understand how we work, most places are an assembly line of people coming in and out. We have the maximum amount of stage 10. What do I mean by that? So if we have a maximum of 5 people and up to stage 10. So if we have 3 people stage 3, we can only have 1 person stage 1. If we have 2 people stage 4, we can only have 2 more stage 1 or 1 stage 2. It has to add up to 10. And our system of staging you may be a little different. You might say, oh, I haven't heard of stage 3 or stage 4, 5. We add a stage to somebody if they are in the situation where they need night care. If you are late stage and you need night care, if you qualify to come here, and you may not, but if you have a lot of small cancers, you may still qualify. So stage 1 is in a location. Stage 2, it's broken 3. Stage 3, it's somewhere else in the body. Stage 4, it's in a main organ. Stage 5, it's in 2 main organs. So pretty straightforward. I'm thirsty. Excuse me while I have a little drink. Hot chocolate today, hot chocolate. So that's how we stage people, and that limits the number of people coming here. We're not an assembly line. It's about quality. It's about not missing the important things, watching you closely, making sure there's nothing missed and nothing overlooked, and you get the best of the attention possible. To me, critically and vitally important. Okay, so let's just go through a few things that if you haven't watched all my videos, you've missed. Questions. So questions. Diet is important, yes. Just quickly, Monday, Wednesday, and Friday, I like you to have mainly vegetarian, but in that unlimited number of eggs. Keep up your proteins. It's critically important. If your albumin becomes too low, you fill up with fluid. You cannot fix the problem quickly. It becomes a critical health issue that can be the reason you fail and don't succeed. Fluid is your #1 enemy. Getting sick is your #1 enemy, and fluid is #2. It's something that's completely avoidable. And you need to keep up your protein. So egg protein is very easy to digest, enjoyable. You can get it in powdered form, liquid. Eggs, egg whites is the important part. The yellow of egg is good for you, especially if it's soft. But if you can have 3 egg whites with every 1 egg and have a couple of those a day, if your protein's a good level, that'll help keep it there. If your protein's down, you need to add more than that. Now, I think it's an idea because of salmonella to avoid eating raw eggs. Despite the fact that you see weightlifters putting down a lot of eggs, you can actually buy in the US egg white liquid, organic egg white liquid in jars. There's a lot of egg white in that, so that's a good thing. If you fry that up and mix it into some rice or whatever your favorite food is, well, that is said to be safe to drink. They're pre-testing that before it goes out, and there's no salmonella risk. We don't have that luxury in South America, but that is a good option for you. I actually watched a chicken documentary the other day, as we're on a farm now and we need to learn a few new skills about chickens or chooks. Okay, so keeping your protein up is extremely important. The third thing is routine. I can't stress enough the routine of your diet. So Monday, Wednesday, and Friday vegetarian, Tuesday fish, Thursday poultry, weekend a little bit of whatever you like. Avoid any processed and added sugars, processed food or added sugars. I consider that really important, but the important thing is eating to routine, and the meal size is, you can see the meal size. You can weigh yourself on a weekly basis and see you're maintaining weight, you're losing weight. The other thing that I think is easy to do is a very light set of weights. Now that'll depend on you as an individual, but doing some weight exercises with your arms and with your legs be that walking, be it just squatting a little tiny bit. You know, when you wake up 4 or 5 times, little squats before you sit down on the living room couch or chair, recliner. Do a couple of little squats and do that to routine to help your muscles have circulation and maintain strength. This is important for you to survive. The problem with cancer taking away your energy, eating away your muscles, a lot of alternative therapies have a chance to win, but they cannot win if you lose your strength, if you become too weak. You die before they have a chance to work, and this is really important. Many of our IVs are designed to give you a lot of strength and maintain that strength while you succeed in surviving the die-off of the cancer. The complementary therapies, I just searched on Google the top 10 alternative cancer therapies, and I certainly never did, and I don't think anyone that I know has ever said that hyperbaric oxygen is a cure for cancer, but in Wikipedia somebody's claiming that somebody said it. These things accelerate healing. Hyperbaric oxygen has got more peer-reviewed studies out there than most therapies. Why? Because it's a multi-million dollar, multi-billion dollar industry. There's thousands of hyperbaric oxygen chambers out there, and people have studied and seen the results of people who had no sign of recovery. Then they go on a hyperbaric and it helps them recover quicker. That's from surgery, from plastic surgery, from accidents. Bone injuries is very well documented. People who have had fractures that have never healed go in a hyperbaric for 2 to 3 months, and they see amazing results of the bone starting to knit where it was not knitting together previously. So the things that we complement your therapies with are not necessarily a cure on their own, but they're what I call a multiplication factor. So you have a fire in the back room, you want to use the hose, you want to use a water pistol, or you want to call in the fire brigade, you want to call in the Air Force, the Army, you want to have everything thrown at it. That's what you get at Atlantis. At Atlantis Health Retreat, we combine everything that works together to smother the fire and put it out in your body once and for all. And this is important. Delay is a big problem for you. It's no problem for me. It's a problem for you. And in some cases, we've had people who have delayed and then they couldn't get in because we had our number. We could no longer fit the people in because we only take up to 10, as I described before. If you're stage 4 or stage 5, that's only 2 people we can have at a time. Because we've learned that those later people, you know, there's a lot more injections of GCMEF in the areas of their cancer. There's a lot more hands-on, and there's a lot more care needed to help get success. And so that's why the price goes up with us as per the stage you're at. A lot of people think that they're well because they're sitting in a chair all day doing nothing. Some people may be fit enough to run and walk and climb mountains, but you come to a day when you're not. This thing will sneak up on you and you will not be able to do the things that you thought that are amazing that you're doing them. Other people aren't doing them, so that means you're going to win? No, it doesn't. It certainly means you're a good candidate to win if you get treatment quickly. But if you delay, you're going to be just another victim of the I thought I knew better group that fail daily. And I wish with all my heart that you could hear the stories and see what I call victims of stupidity that I talk to monthly, that it brings a tear to my eye, just the thought of how beautiful these people were, how nice they were, how intelligent they were, and how naive they were to believe in something that, from experience and what I've seen, had no chance of helping them. And so I just strongly recommend that you tackle this thing with aggression, with all of the speed that you can do, whichever direction you go and whoever you choose to go with. Okay, so I'm going to go through the list now, just quickly, and to give you the little Easter eggs for them all. Thyroid cancer. Um, so my mother-in-law comes to mind. She was diagnosed with thyroid cancer after a biopsy, and it was obvious that it was cancer before, in my opinion. But anyway, she went ahead and done a biopsy. Then she was due to have surgery to have her thyroid out, and she came to see us because there was on the system she's in, there was a 2 or 3 month delay. So she had 6 weeks of treatment with GCMAF, 1 month I think of IV therapies. Anyway, the cancer completely went down a lot in that short time. Then there was a pandemic and she couldn't get to us for 6 months. But she had the GCMAF and she kept taking that orally. And then after the 6 months, she went to see the specialist, and they said, "Oh, they cannot see it anymore. They couldn't find the cancer, but it was positive that you had cancer." And in the public system here, they strongly recommend that she have the surgery and have her thyroid removed. Despite us telling her we don't think it's necessary, wait another 3 months, let's do a full scan to see what's going on. She went ahead and had the surgery. There was no cancer left in the thyroid, and she's lost her voice now. She sounds like a canary, which is sad and disappointing and frustrating. But you can show people the water well, but you cannot make them drink. And you can show people 2 doors, and you got a choice going this way or that way, and it's their choice. They have to make their own decision up, and I can only sit back and have my opinion as they have theirs. But at the end of the day, I'm not talking you into anything. It's your choice, because you live or die by your decisions. I can only tell you what I see, what I witness, and what I believe you should do from 23 years of full-time helping people with cancer. So the thyroid cancer is great to inject around it. You can see shrinkage. Esophageal cancer, you drink the GCMAF, but high pH therapies, especially if it's metastasized, most common goes to the liver. In fact, you see a testimonial. Under testimonials, you see Gordon, who went in for surgery, didn't know about alternatives, went in for surgery. They opened him up, saw his liver was full of cancer, shut him up and sent him home to die. Didn't bother cutting out the small amount of cancer. He had a large growth in the esophagus. At that time, we didn't have the high pH therapy, but he became cancer-free over 6 months on the basic therapy, which is great news for him. He was a low-income client, so a farmer. He brought me boxes of vegetables every time he saw me. I'll always remember him as a staunch friend and a great person. And I miss all my friends in Australia. So esophageal cancer, the high pH therapy is the best. If you just had it well, even then, yeah, I think it's necessary, the high pH therapy with that. Lung cancer, the same. The problem with lung cancer is it takes too long to get rid of it with other therapies. It's a 6 months to 12 months, where with the high pH therapy in 2 months it should be gone, and an extra month to make sure. Liver cancer, you need to do rectal infusions, which is just a 30 ml of liquid after you've passed your stools, or you do, if you do not have fibroids or anything like that, fibroids, if you do not have any bleeding or problem in the rectum area, not fibroids, you do a rectal syringe of about 30 to 50 ml of liquid, and with that, in combination with all of our other therapies. Now, liver cancer is one of the hardest ones for traditional medicine to cure. In fact, in most cases, they just say go home, that we cannot help you, or we can try this experiment. But all cases of liver cancer we've succeeded with the exception if the bile duct, and if you've needed a stent put in the bile duct and it continuously gets infected, it tends to affect outcomes. But if you do not have problem with cancer affecting the bile duct, you have a very good chance of a positive result. 2.5 years, all bone cancer we've had success with, which is great. In all types of bone cancer, all types. Your blood flows through your bones, so the bones get all of the products that we're giving in IV directly to the tumor. So that's probably why I put bone cancer as the number one, the most we've succeeded with. Esophageal cancer, it's half a dozen in the last few years. We don't have hundreds of cases because we're working with such a small group of people. It's not a assembly line of down this line is breast cancer, down here is prostate cancer, down here is bone cancer, and so on. No. So yeah. Endometrial cancer, the good thing is we can inject around that area. The big thing you have to be careful of there again is the lining of the stomach and the lining in that area, including the colon getting cancer growing into it, and that adds complications to it. So time is of the essence. People who delay with these lower organ cancers is making a big mistake. Vagina, the good thing is, again, like with prostate cancer, the rectal infusion. With vaginal cancers, you can do the same infusion into the vagina, and that way we're getting the anti-tumor products directly into the area of the cancer, and it helps things move much quicker. Similar with breast cancer. Breast cancer, not only can we eject around the tumors, if it hasn't invaded the whole breast, if it's invaded the whole breast, it's difficult, time-consuming, takes longer, and it's harder. But if you act quickly, if you hear my words, there's a fire in the house. If you've got a tumor that's under 2, 3, 4 inches, and act quickly, it can be disintegrated pretty quickly, even if it's gone to the lymphatic system, liver. As long as they're all small, you have a very, very good chance of success. Don't let people tell you you're not going to make it. It's not true. You have a very, very good success, very good chance of succeeding and beating this thing and keeping it away, and the tissue repairing and keeping your breasts. Lymphoma cancer, we've got, I think, 3 or 4 people in the testimonials with lymphoma. Just remember, most people don't like doing videos, okay? So we ask and we politely refuse. Sometimes people do not want to have their story told or do not want videos about them online. Many people come and their family doesn't know. They have no idea that they have cancer, and they like to keep it that way. So that we respect. Oral squamous cell carcinoma. This has got some advantages, that you can inject around the area in the mouth inside and get the GCMEF directly on it. Also, when we're doing the high pH, you can take a little bit oral and hold it on top of the tumor. If we increase the tumor's pH a lot, the cancer can no longer ferment sugar into energy, and it'll die off, and it'll die off very quickly. So that's similar to breast cancer. We can make a cup, like get a plastic bowl. We can put the product, the high pH and anti-tumor products onto it. You can lean over and then lay backwards with a cup over your breast and completely saturate the breast with the anti-tumor products. And these are little Easter eggs, little secrets that we use to break through the barrier of success rates. It would be hard doing a peer review of us because everyone's different, and we find ways to put this fire out in your body. We find different ways, and everybody's, some people are not willing to do the rectal infusion. Like 50% of men with prostate cancer will say, no, you're not. They have an emotional issue and they will not allow a rectal infusion, which is ridiculous. Dye, rectal infusion. It's a tiny little bit of liquid that you put in and you lay down, you go to sleep, it doesn't come out, and it's so simple. But some people will choose to die because they're harboring an emotional issue that has put them in this situation, probably in the first place. So the oral mouth cancers, again, you can inject around them. Anywhere in the throat and up is the fastest results. In fact, when we do the high pH therapy, the first sign that it's working is people feel all the tingling in the mouth going numb. and that's the product is getting into the muscle and making the muscles relax a little bit, and this is a good sign. Straight after that, if people have pain, the pain is usually gone. It doesn't stay gone in everyone all the time, but in a lot it does. Cancer pain is caused by the acid of the dying cells. So when we put in a product at a very high pH and the dying cells acid is burning you, that pain disappears, and so you no longer have the pain. The high pHs neutralize the cancer's ability to ferment sugar, and from that moment it's dying, my friend. The cancer, you can measure it. You can every 5 days do an ultrasound and you'll see it gone minimum 1%, usually more, per day. So in our 90 days program, usually the cancers are eliminated. The fire's put out and they stay out. You don't have any more concerns or worry about. That's why in our guarantee, if you read in the link, the guarantee, we guarantee if the cancer's gone and if it ever returns, you can come back at such a low rate to keep it away. Or better still, you can return on an annual basis for that low rate. It's just a holiday rate, and we will give you all of the anti-cancer products, including GCMEF, injected in the area where the tumor was, to keep it away. That's an amazing guarantee. Nobody else does, because we think it's important to have you as a talking testimonial to other people, and to keep those that the man upstairs guided us to help you become cancer free. We want to keep you that way, and so most people do not have the cancer return. In fact, I can't remember anybody who did. But doing the annual here in our clinic, we do have people coming for those repeat 2-3 weeks of IV therapies, and we love to see you, and you inspire other people on the program that are here, get to meet you. And you're not counted in the stages because you don't have cancer. We do have people coming for just general wellness programs, and they're not counted in the stages. Okay, how am I doing time? 30 minutes, doing well. So I covered all of those cancers. So thyroid, you inject locally. Esophageal cancer, I think all of the cancers need high pH therapy, but we have had success with thyroid and esophageal without doing the high pH therapy. In fact, all of them except bone cancer. Until the GCMEF, we didn't have success with bone cancer, except with high pH therapy. So I've had success on somebody doing home program with bone cancer. So the GCMEF did work for them, injecting locally into the spinal area. But again, it's critically important that you move fast if you have cancer in the spine. They don't always mention this to you, but eventually you may become a paraplegic. And this happens time and time again. It happens without notice. You start to lose feelings in your legs. You can't stand up. You can maybe make it to the toilet and back, but your legs feel numb, and eventually you're a complete paraplegic. So time is of the essence for all cancers, but specifically if you have it in the spine, get here next week. Don't delay. Be approved first, because if we cannot fit you in, that's I'm sorry, really sorry. The new facility will allow us to have up to 30 patients here. So that will change things a lot, and the scale will help us reduce prices a lot. I'll be semi or almost fully retired, but there'll be a team of surgeons and doctors, specialists working here to look after you and make sure you get the best of care and the best results that are possible. Okay, so we covered a little bit on diet. So Monday, Wednesday, and Friday is mainly vegetarian, lots of eggs, also tuna, especially farm-grown tuna. I would consider possibly better, taking away any risk of mercury. But I think you have to eat. You can't avoid all chemicals, but you can change what you used to eat a lot of. You got cancer maybe because of your environment. Like I had 2 young boys 20 years ago, two boys that had brain tumors. It was surprising that one spoke to somebody and told the other one that he knew that this other boy was coming to us. So this is going back 20 years. I couldn't believe that they both lived in the same street, because I went to visit them in their house. They both lived in the same street, and behind the house was high voltage, long distance power poles. You know, the ones that go from capital city to capital city, or from the generation place to the capital city, right behind their house. The other common thing with other people with brain tumors is they lived in a house, the master bedroom had the power supply on the wall where their head was. And so I would do everything to, number one, remove mobile phones away from your body. Number two, girls are the worst ones. I see them on the beach walking with their mobile phones down their pants, right on top of their ovaries. Now, ladies, you should know to tell your daughters where the ovaries are and that they are the future. And a lot of them today, oh, we're not going to have children. You don't know. But the last thing you want is to bring a child into the world that's damaged because you radiated the eggs. You cooked the eggs before they were fertilized. Do not put your mobile phone next to reproductive organs, ever. Ladies, in your top pocket near your breasts. Everybody should have the mobile phone a distance away, and in nighttime it shouldn't even be in your room. It should be, and if it is in your room, it's in the farthest corner away from your head that you could put it. We survived so many years without this technology, and now people cannot put it down for a day, a week. Now I went without mine for 2 years, a few years back, to show that it could be done. 2 years. No mobile phone. I just used the internet. People left message and I got back to them, and guess what? I survived. I survived. It worked well. Okay, so that's a little bit about the diet, the routine, and don't play games with therapies. I cannot stress enough. I just explained to you the people who delayed, they already made a decision that they were going to come here or go to somewhere. That's fine, but the delay is really, really stupid, dumb. That's all I can say, because I shed a tear for one man who two men, and they had bone cancer, and one had 17 and I think 19 and 22-year-old sons, and he sent me a video of him and the boys in a four-wheel drive. 2 weeks after that, he couldn't walk. The spine cancer had penetrated and affected his mobility. This was avoidable. This was completely avoidable. And it's not too late if you've lost your legs. Get here quickly. The quicker the better, because things can heal. Those bones go back to normal, and once you can walk again, you can get into hyperbaric and accelerate the healing. It's priceless to see that all reverse and your body healing. And you know, when you cut yourself, your body heals. It's the same with cancer. The area will return to normal if you're doing the right therapies and if you're putting in all of the right ingredients into the body to help the body accelerate healing. The body is made up of over 90 minerals, and our combination, orally and IV, is putting all of those vitamins and minerals into your body so that your body has the raw materials to remake you, to repair you, to make a new you, to make you feel younger, to give you strength. When you feel strength, your immune system's fired up and your body will heal you. We're just a side effect. By putting the raw ingredients in to make the right cake, you cannot build a car without a spark plug. You cannot drive to work without the valve in your tire. The cheapest, smallest things are sometimes the most important things. Sure, you need a motor. You need your lungs. You need your liver functioning well. So if there's a problem with the liver, we have 3 different therapies and 6 different products orally to accelerate the detoxing and the recovering of the liver. Number 1 organ, next to the pancreas. We have special IV therapies to help the pancreas become stronger. It releases enzymes that are important in the action of fighting cancer. So just focusing on the problem, the fire, when there's the reason for the fire is the gas has been left on or there's petrol leaking, you need to look wider than just the problem. You need to look a lot wider. You need to look at the whole body as a whole and work very hard to heal everything that is wrong with the body. If you have a sore knee and you have cancer in the spine, the sore knee is equally as important because it's distracting the immune system. Your macrophage are going down there to repair that instead of fighting the more critical issue of the tumor, which is not causing any pain. You just know that it's there. So I can't stress enough about the combination of therapies. Making all of the organs strong and healthy is very, 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 very important. Please watch the video. I'll put a link up here to the last video I did on high pH therapy. If you didn't look at that after seeing the intro that I posted a few days ago for this video, I think it's important that you watch that. It explains the science behind that one therapy. In the coming weeks, hopefully next week, but we've been a little busy, I'll be posting a special on GCMAF and the importance of that, how it works. It reactivates your macrophages, turns them back on when they're being turned off by cancer. Cancer gives off a chemical called nagalase, which turns them off, and so it wakes up the sleeping ones, number one. It makes new macrophages by mixing with vitamin D. And macrophages are like little snails that crawl around in your body, and they go to anywhere that needs healing. And there's a lot of speculation that you do not need to inject in the area. Let me tell you, it's I would say 100 times better if you can inject where the tumor is. Now, you cannot reach all tumors, but if you're lucky enough, unlucky enough, if you're fortunate enough to have a tumor in a location where you can inject around it with the GCMAF, the results are much quicker. And we've tested that by injecting one person with two tumors similar in size, and we just focused on one and it disappeared, and then we focused on the other one. So there's a definite, not scientifically proven, but visually our experience, which I think is more important than any peer-reviewed study. What we've seen, what we've witnessed, and is far more important than what you read in a book. So that's my summary today. The prices, I didn't open the prices. Depending on what stage you are at, without high pH therapy, our programs are almost or close to 40% less. High pH therapy is the best. It's very expensive, and when we talk expensive, if you want to fight cancer for 3 years, or you want it over in 3 months, it's actually cheaper. Even though your out-of-pocket in the short term is higher, it's much better to get rid of the cancer in 3 months than still be fighting it in 2 years. The combination of natural therapies can take many months. Our combination, I don't think many tumors doing everything except the high pH therapy will be gone in 3 months. But when you do the high pH therapy, it comes with that guarantee. Why? Because we see most cancers are gone in the 3 months. And we do the CT scan. Everything's included in our program. That's important to tell you. So we like to do a scan when you arrive, an all blood test, an ultrasound. Why do we do an ultrasound and a scan? The ultrasound is harmless, and so the therapist gets to see exactly the size and measure it with her machinery, and then we can do it again next week and the week after, or every 2 weeks, depending on if the cancer is seeable. So if it's in the liver, we can see it. If it's in the kidney, we can see it. If it's in the adrenal glands, we can see it. Usually. If it's in the breast, we can see it. If it's in the bladder, we can see it. If it's on the pancreas, in most cases we can see it. Very difficult with the pancreas to see, but in most cases we can see it. So there's the big Easter egg for you, is that we have reduced the price. Now there's two prices just starting today. Nobody's been told these yet. So there's a price without the high pH therapy, which brings down the price a lot. Number one. The program is still the same. 2 weeks, week off, 2 weeks, week off, 2 weeks. So you arrive here, it starts off with 1 week, week off, then 2 weeks, week off, 2 weeks, week off, 2 weeks, week off, 1 week. You only have to pay for half, and if you're happy to continue the second half, that's fine. That's on all programs now, so you do not have to pay for the whole thing in advance. But after a month of being here, we require the payment for the last half, because we have to fly somebody in with the product specifically for you, for each half. So we're doing that many flights at the moment that we're quite comfortable. Before, people had to pay the whole lot, but now we've changed that. So you only have to pay for there's $7,750 out of pocket per month. That's to pre-book your apartment and to cover our out-of-clinic costs. Then the rest of the program, you only have to pay 50% of that. Depends on the price for you. So they've all been renewed this week. The prices have changed a little. Stage 1 is much cheaper. Stage 5 is the same or similar. So in addition to that, today is the 12th of March. So in addition to the special big reduction without high pH therapy, we will be giving a very large discount. I'm hesitant to give the amount because some people are, it depends on the stage they're at, but approaching $20,000 to $30,000 off. A minimum of $15,000 off, but an average of 20, and some people will get $25,000 off. So the only additional cost we have is the port, which is $4,750. If you don't come to us and you're going anywhere else, get a port fitted, get it on insurance. It's $47,000 in the US. Crazy. But if you come here, it's $4,750. Includes our team staying in a motel close, a hotel, and that's a Wyndham hotel. And so we're there. It's an hour, 30-minute procedure, but they like you in there 2 hours before and 2 hours after, so it's half a day. And that's it. So we look forward to seeing you. It's GYE is our airport. GYE. We pick you up at the airport. We look after you. You're not left alone the whole time. Doesn't matter who you are. Doesn't matter whether you're here for cancer or a wellness program. We like to hold your hand the whole time. We stay at Trip, TRYP by Wyndham the first night. Most times, they sometimes book out, so we have to use a different one. We like that because it's joined to a shopping center. Unlimited different foods, organic shop, people who are full vegetarian. It caters, there's all the different chains that you have in the US. Most of them are in this shopping center. It's a two-story, very long, large shopping center. If you forgot your phone plug or something like that, there's an Apple store there, and clothes, anything you need. So quite often people might buy a few things while they're in that shopping center that they think that they need, and then that's it. The day after, so we have a nice night's sleep, you have breakfast, you may have the port fitted, then we head to your accommodation, and the next day is Friday. We introduce you to the staff, you meet the doctor, have a full examination, you rest all weekend, and Monday morning we start to kill the cancer, eliminate it, get it out of your life. We have a lot of laughter, we may have a few tears, but we will win the battle. We'll hold your hand, and we'll help you get stronger and stronger and stronger, and do everything possible to attack this cancer as if you are family. That is the way we look after you. We think that's important for you to understand. In our clinics, you're not on an assembly line. You're family. We're fighting for a victory, and we'll do everything possible to make sure this cancer is eliminated with all the little Easter eggs and tricks that we've learned over 20 years that have helped bring outcomes that are positive where before that they failed. So I hope you enjoyed this little video. I look forward to talking to you on the phone. Go to the website atlantis-health-retreat.com. There's a few testimonials there, not many, but there's one for you. There's the link for cancer therapies. They're half or less of the therapies that you will do when you're here. We do a lot of things, and we don't put everything on the website. So many people are copying this, people claiming to be doing high pH therapy, and I promise you, they are lying to you. They are not. I'm the only one that met with the doctors, done training, and offer IV high pH therapy. And I can tell you, these people taking 1 gram or putting 1 gram into vitamin C are causing your cancer to grow. It's dangerous and stupid, and it's happening in the US. And they've told me now, after a consultation with management in this particular place, that they're not offering it anymore. But I promise you, if they are still offering it and you're still doing that, you will not only not win, but you'll never get rid of your cancer, because the high pH therapy can only be done once, and it needs to be done properly to get a result. The reason being is it accumulates in the body, and you get to the point where you cannot take it anymore. And that is a big problem. You want to be able to take it. Okie dokie. So just click on this. Don't forget our video channel. Watch all the videos. Click on videos. That will allow you to see the latest videos that we have. What's next? What is that? That is Facebook, I think. Facebook, Twitter. So it's important to be educated. What happens when you watch videos? You learn the right questions to ask. And if you want to beat cancer, it's the questions that are important, because you're researching and you want to find out what is best for you and your cancer type. So please do the research, watch videos, read the website. Don't read all of it. It'll drive you crazy. That much I'm pretty positive of. But please, again, watch the videos that I'm linking up here. Stay tuned. The best time to watch a video is nighttime. Just sit back, choose the playlist. We have a playlist of 2023 videos, and just let them play in a row. Sit there, fall asleep listening to them. You'll get to understand so much. You can also go to 2021 playlist, 2022 playlist. We've been on YouTube, I don't know, 10 to 20 years. And we're very cautious what we talk about, because Big Brother will block us. And so we're very tactful with what we say. We speak from the truth and from hands-on experience, not hearsay. I think that's important. There are so many people promoting alternative therapies that they've read a book on, trying to help you. But certain therapies are hit and miss. And that's the reason we combine everything, because you don't want to find out it didn't work for you and then you need another 3 months to try something else. And with 10 different therapies, by the time you've done them all, it's years would have passed, and you've had a lot of scans, and which is bad for the body to do them too much. And so please treat this as urgent, like it's a fire in your house. The other thing, if you come here, you can bring the family, you can bring friends. You can have a 2 or 3 bedroom apartment. It doesn't cost any extra. It doesn't cost extra for your family to come. We're happy to host them. They can come in when you have induction, but they will not be there when you're having all of the treatments, because for other people's privacy, we prefer that you're not, that they are outside enjoying the beach and the sun, hopefully sunny. Like I said at the beginning, it's the rain season. It finishes at the end of this month, but we've had 6 weeks of rain. It's not raining today. It's beautiful and sunny, but it's beautiful. The place is greened up, and it's lovely. I hope the weather's fine where you are. I hope you're eating well, you're taking your vitamin D, calcium K2, and getting the combination that you need to fight your cancer correct. If you're not, fill out the online form, click the link, make an appointment, ring the operator. We have an operator that's standing by for you to leave your name and phone number, email address. I'll email you a link, we'll talk on Skype, and let's start taking the steps to making you healthy, to eliminating this cancer. Most important, making sure you're not doing the wrong thing at the moment to make things worse for yourself. Until we catch up, until you make the next move, you have a great day. Sending my love and energy to you, and bye for now.